So what is psoriatic arthritis, or PSA? It's chronic inflammatory arthritis, which is associated with the skin disease psoriasis. I'm sure everyone knows that here, because I'm sure you all have an interest in this. Chronic means it's a long-term disease, a long-term condition. Is something that you live with, unfortunately. And it is inflammatory arthritis, which means that predominantly involves the joints, and there's inflammation in joints. But it's a very multifaceted disease, which means that there are lots of different phases of PSA. So as well as the arthritis, which, so you get a sort of peripheral arthritis. And when we say peripheral arthritis, we mean joints in the arms and the legs. So there's an example of a swollen knee. So you can see the difference between the two knees. So this is a swollen knee, so a knee inflammatory arthritis. But as well as an arthritis, actually, you can get lots of other things in PSA. So you can get a spondyloarthropathy. So some patients actually have pain in the back as well. And this is an MRI of someone's joint in their bottom called the sacroiliac joint. And on the MRI, you can see that the white bits is actually inflammation. Okay, so as well as arthritis, you can also get back involvement. And as well as that, we can patients have telltale signs in their nails. So they have nail disease. And this is a close-up of someone's fingernail. And you can see the little nail pits, as well as this white thickening of the edge of the nail. So this bit, so we all have a white nail, but in people with PSA, they can get quite a thickened one, which sometimes is mistaken for fungal infections, and it's the medical term is called onycholysis. So these are kind of telltale signs of PSA. Patients can also complain of pain in their tendons. So the medical word of it is enthesitis. So the enthesis is where the tendon or ligaments join onto the bone, so insert into the bone, and sometimes that can have inflammation as well. So this patient has Achilles tendon that's swollen. So you can see that the right side is a lot more swollen than the left. And lastly, the patient can also get a dactylitis, which means that they can get a whole finger or a whole toe that's swollen, and that's more to do with the tendons, and they end up looking like a sausage. It's so big and painful and swollen. So just moving on to talk about the actual arthritis a bit more. So this is actually what we teach people, medical school medical students all the way up to junior doctors. So there are different types of psoriatic arthritis, different types of joint involvement. The first type is kind of like a mimic of rheumatoid arthritis, actually. So you get lots. It's a symmetrical arthritis, which means that it happens in both sides, and all the small joints are involved. So particularly the knuckles of the hands, as well as the toes. They tend to be involved. They tend to be hot and swollen. Another type is actually more of an asymmetrical, so not the same on both sides, and that tend to be involved more of the large joints, like a knee, so like the picture I showed you earlier. And in psoriatic arthritis, you can also get just involvement of the little joints, so distal interphalangeal joints. And that's more classically involved in patients with the nail signs as well. Spondylitis, the same as spondyloarthropathy, so patients can get bum pain or back pain or neck pain. And there's another type which is quite rare called Arthritis Mutalans, when there's so much inflammation and destruction of the joints that actually the hands get very deformed and mutated, so i.e. the word mutilans. But thankfully that's rare and is becoming rarer. So this is a schematic of that. So some people actually call this telescoping of the fingers, where there's the joints are so destroyed that you can kind of extend, and the fingers are shortened.